This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm T.G. Lafredo, and this week on the program, my guest is Tom Bress. He is a behavioral health case manager and a licensed professional therapist at KRMC. He's been leading an 8-week group on managing chronic pain. We'll be talking about that group and strategies for dealing with chronic pain. Tom, welcome to the program.
Thank you very much.
Let's jump in on this. Tell me about the group. When did it start?
So I've been running this particular group since April of 2022, and we run it for a specific period of time, 8 weeks. We take a few weeks off in between and then run it again.
And how often does it meet? Once a week?
We meet once a week for a 2-hour period.
How many participants do you have in any given 8-week session?
It ranges from anywhere from just a few people up to 8 to 10 people.
How has attendance been?
The attendance has been a bit of an issue. That is something that I'm trying to improve on because I have unfortunately a high dropout rate. So we start with a certain amount, and by the end, it's only a couple of people who are finishing.
Yeah. I don't want to sound insensitive, but is that kind of part of working with folks who are dealing with chronic pain?
It seems to be a common area for the people who are having a difficult time, not only with motivation, but transportation issues. Their pain level fluctuates, and so there may be weeks at a time where they're just not comfortable enough to come in.
Is there a broad range in terms of demographics? I'm wondering, are many of your clients working, or are they disabled, or are they older and retired folks?
In looking back at all of the groups I've done so far, I've had just a handful of people who are still in the workforce. The general age is anywhere from early 60s into late 70s. I've had a few people in their 80s. And generally, it's about 80 to 85% females.
How do people come to you? How do they become aware of the group? Is it by referral, or is it they see the signs around?
Originally, we went on a provider referral basis. So you had to be referred by your primary care physician or pain management doctor. We opened that up a few months ago to anyone receiving any kind of medical services through the hospital.
Okay.
Is eligible. We do promote the program on our intranet at the hospital. We have flyers in all of the offices, and we present it at different functions in the community as well.
For participants, is there a cost associated with it?
There is no fee. Our program is funded by a grant. It's called the SOR grant. It's based on state opiate response. And so it pays for this program as well as another program that we have.
Pain is complicated. I remember years ago I was speaking with Dr. Sarah Knievel. She's no longer with us here at the hospital, but she's a pain management doc. And
Yes.
She was saying pain is a complicated process where, I'm paraphrasing, but people have different pain tolerance and people have different perceptions of what pain means to them.
It's a very mysterious thing, and it's one of the first things that we get into in our group is talking a little bit more about people telling their story and sharing their experiences and understanding that there is a huge difference between temporary pain that we all experience at times when we're injured or we hurt a muscle, as opposed to chronic pain, which is long-lasting, day in and day out, very persistent. So it's almost, it's in the same ballpark as someone dealing with chronic illness, chronic depression, anything that's a chronic issue complicates our lives because it is so persistent in something that we can't just wish away or fix in any way.
I'm sure your clients all have their own stories and it's hard to generalize, but what are you seeing in terms of how they got into a situation where they had chronic pain? Is it an accident? Was it a work-related injury?
It's a mixed bag. I think that for those people that are longtime sufferers, I've had stories of people that injured their backs when they were children or in early adolescence, and it's something that's carried through their whole lives. Other people, it's more of a gradual onset of the aging process, perhaps a family history of arthritic pain or osteoporosis. Mm-hmm. So I would say that it's different for everybody. It's not as often a work-related type of injury that brings people in, but that can happen. Any injury to the spine, and especially the lower back, that's predominantly the source of most chronic pain. It can happen in a lot of different ways, and it can gradually worsen over time, again, as we disengage from our normal routine and seek all of the variety of different therapies and treatments to try to improve.
You said that when you convene the groups, one of the early topics of conversation is perception of pain and what pain is. Can you give me a little bit more about what you work on in the groups?
So, one of the first theories that we introduce and talk about is the pain gate theory. And that was introduced several years ago by a team of doctors and physicians that looked at area in the spine, and we kind of look at the system, how the brain receives signals through the spine, and kind of looked at, in theory, something called a pain gate that opens and closes. And when it's open, we're receiving a lot more high-intensity signals to the brain that alerts and creates more pain, and things such as high levels of stress, negative mood, negative thoughts. Those things tend to exacerbate and intensify that pain gate. So we work on closing that pain gate through some different approaches, through meditation and mindfulness, relaxation activities, overcoming the negative thought patterns that persist, trying to recognize and treat depression, because that very commonly goes along with people who suffer from chronic pain.
Sure.
So early on in the beginning, we do focus on that, as well as now that this is something that you've been dealing with in your life, what do you want the rest of your life to look like? How are we going to manage that pain and learn how to deal with it, basically?
When you first put those questions to a client, is it more of a rhetorical question, or is it, hey, really, how do you want to live your life?
It's a little of both.
Yeah.
I think in rhetorical sense, it's not like this is a new thing that just happened to them. For the most part, these people come in having exhausted, many different attempts at treating their pain. So this is, another thing to try out. So I think that in one way it's, I don't want to pretend that this is something they don't know anything about. But number two, I think knowledge can enhance your outlook. And the more you feel you have some control over your pain level and what you can personally do rather than relying on others, the more confidence that gives a person, and perhaps reevaluating their goals and their activities.
You alluded to different things that clients have gone through to try to alleviate some of that pain. A big factor in this conversation has to be opioid use.
Yes. We have gone from having opiate medication introduced as a focus of treatment for chronic pain, and the manufacturers promoting the safe use of this medication. It was never believed to be something that people would have that much of a problem with. And so, copious amounts of medications were prescribed over years, and the unfortunate outcomes of that were, addiction, dependence, extreme withdrawal when dosages were reduced, or people wanted to come off of the medication. So we went from that and into the opiate crisis that has affected so many, to where we are now, where it's heavily regulated by our government. It's all pain management programs across the country are encouraged to reduce the amount of prescribing and try to effectively titrate people down from the high amounts of opiates that they've been on. Of course, there's been pushback and resistance because of, what are we going to do to treat this pain now?
Right. Those are the unintended consequences that have come of this, right?
So it's been a hard road to encounter kind of where we've been to where we are trying to go now. And so a great reduction in the dispensing of opiate medications has been transpiring. And, I think it still has its purpose and benefit, within safe measures. I think that people can still lead a fairly normal and substantial life with medication, but we'll see what's on the horizon, because there's always alternative sources of treatment and medications out there to look at, and those are things that are being tried.
Pain is complicated also because it can be such a vicious cycle. You hurt, so you are less active, but then you're less active and you hurt. Mm-hmm. And then out of all of that, in general, depression starts to become more of a factor, and it's just like, oh, what a spiral. I've read a bit about some of the alternative modalities, speaking of yoga, tai chi, qigong, things like that. The idea being to keep the body moving, to stay flexible, to keep breathing.
Right.
Have you looked into these things, or what do you know about them?
So, that's a part of our group program to get people invested in doing their own movement and their own form of physical therapy. I know that there are a number of things that once a person, which most of our patients participate in some kind of physical therapy, so they have exercises that they take home with them from that they're encouraged to use. We promote more mindful relaxation and methods to get a little bit more into the thought patterns involved with coping with pain day in and day out. The vicious cycle of when we're hurting, we don't want to engage as much in physical activity, and the result of that, by more inactivity, the more body, freezes up and stiffens up, and we're going to have more of a struggle being physically active again. So we have to keep moving as much as possible. And so walking, swimming, stretching, all things that are vital to keeping our body as elastic as possible.
I had the opportunity to speak with someone who's been participating in Tom's chronic pain management group. This is Marie, and here's a little bit of what she had to say about her experience.
Chronic pain became a factor in my life when I was just about 76 years old, 77. And that's when I found out that I had spinal stenosis and that I have very bad degenerative arthritis. Up until that time, I had no pain. And so I didn't know how to deal with it. And then it became almost unbearable at times. If I lay down or sit in a chair, I'm fine. So I could sit all day and be a happy camper. But if I get up to clean the house or cook dinner or anything like that, I feel like a giant is grabbing my waist and my back and pressing in. Very painful. My experience with Tom's class has been very enjoyable. It's been very enlightening, and it helped me in my daily life. Other people in the class shared stories about their pain and what they did for it, and how a lot of them had taken medication because they had surgeries and they got hooked on the medication and had trouble getting off of it. And I have never taken any medication. And I just figured, if you have to get off of it eventually because it's not good, then why bother to get on it in the first place? So train your brain to do what it can do for you. And being with the people, I love people anyway, so it was very beneficial for me to be able to come to this class and to participate and have people listening to my story and be interested in my story and then sharing theirs.
If you're just joining us, this is Focus on Your Health. I'm T.G. Lafredo, and this week on the program, my guest is Tom Bress. He is a behavioral health case manager and a licensed professional therapist at KRMC. He's been leading 8-week groups on managing chronic pain. Tom, you brought in some lovely materials. I'd like to talk a little bit about the materials you use to work with the groups.
So the group is outlined in an 8-week format. And at the beginning of the group sessions, everyone receives a notebook with 8 specific sessions outlined in full of materials. We go over those partly during our group sessions and discuss what's in them. Homework sheets are involved in each of those 8 sessions as well. And so patients are encouraged to work on those during the week. We review that homework assignment at the beginning of the following week and discuss the outcomes, participation in some of these exercises. I encourage formulating short-term goals for the week for patients to focus on and accomplish. Each week, as a person achieves some of these short-term goals, it starts to create a level of confidence that they can do more. And I have people that want to do more, of course, and it just gives them a path to follow that allows them to structure their life a little bit more in a positive way.
We know that these clients are going through a lot with the pain that they're dealing with, and you mentioned that attendance can be an issue. How do you gauge success over the course of this 8-week seminar and beyond?
So what we do is there is a pre-group assessment. There's 2 different assessments. One is for the grant that we receive that funds the program. And the second is a series of different questionnaires that I ask them to fill out. Some of them are based on particular fears of movement and or activity. Another one has to do with our thought and belief system. It's called the pain catastrophizing scale. And I also have a handout that focuses a little bit more on where the source of pain is, and a little bit of the historical as well as current status on their pain. And so at the end of the 8 sessions, have them go through and fill those out again and measure the differences in scores, and hopefully the ratings are improved. And then I also have a subjective measure that they list their overall improvement that they see, so that they can tell me what has helped and what hasn't.
Do you ever hear from someone 6 months later or a year later? Do people ever check in with you?
So one of the things that we're required to do as part of the grant is to do a follow-up assessment after 6 months and contact them and have them fill out the information again. And then after a year, we do that as well. So we're following up and engaging with them after they've gone through the program. The other nice thing that a few of our participants have done is I allow them to go through the program again. So I have people that felt like, they may have missed a week or two and they wanted to come back to the program and engage again. And, since there are new people in the program each go around, they benefit from interacting with different people as well, because it is not only a therapeutic program, but it's also a supportive network of people who they can relate to, going through the same types of issues and being able to support one another.
I'm glad you brought that up. I wanted to ask you about it. I talk on the radio, but I'm an introvert at heart. And I feel like if I knew, okay, I need some help, I want to talk with someone, I feel like I'd want to do that in utter secrecy. But these groups, you hear again and again about the benefits of working in a group setting, working with other people who are going through something similar. Can you sell me on that?
Well, yeah, it is difficult when, you're not comfortable sharing your personal stories around other people, or especially people you don't know. But the commonality of, I have that issue too, and it comes up every time. I've gone through that too. Or when I went to see this particular specialist, chiropractor or massage therapist, that really benefited me. And who did you go see? Well, I went and saw this person. And so it's a networking of like-minded people all wanting the same outcome. How do I improve my life and how to cope with this pain better? So there's a lot of sharing and just camaraderie that exists when you come across people who can truly relate to what you're going through and experience, the same type of situation.
I won't ask you to give away any company secrets, but what is ahead for you and for KRMC Behavioral Health?
I think the thought is to keep expanding what we offer, trying to get into perhaps more of our medical services, so that we can offer this in more than just the primary care clinics. Perhaps doing more groups. There's been talk of doing kind of like a stress management group or specific genres of groups. Some of the other counselors have voiced interest in that. I think there's talk of bringing in another child therapist to help lessen the load of just our single child therapist.
Yeah.
Continuing to expand the services. I don't think that we're looking at expanding it outside of Kingman, but you never know.
That is Tom Bress. He is a behavioral health case manager and a licensed professional therapist at KRMC. Tom, thank you so much for your time today.
Thank you. And just remember, there is help out there if you're dealing with this issue.
If you're interested in joining Tom Bress's 8-week group on chronic pain management, call Jeanette Garcia at KRMC Behavioral Health, 928-263-3236. That's 263-3236. And that is the program. Let's focus on your health. Special thanks this week to the aforementioned Jeanette Garcia, to Marie, who was kind enough to offer a testimonial, and to Adam Barnard in KRMC Public Relations. They all helped to make this episode possible. I'm T.G. Lafredo, and thank you for listening. We'll catch you next time.